Consent in medical practice. Consent means a voluntary agreement or compliance or permission. Salient features. Indian Contract Act 1872, Section 13. Indian Contract Act 1872, Section 13. Two or more persons are said to consent when they agree upon the same thing in the same sense. Patient must understand that what it is given for and what are the risks involved. Section 14. Consent is said to be free when it is not caused by coercion, under influence of fraud, misinterpretation, or mistake. Components of a legally valid consent. A patient more than 12 years for general physical examination, more than 18 years for surgery. In case of a child, consent from guardian who should be more than 80 years. Patient understand that he can either agree or refuse to submit to examination, diagnosis and treatment. Has been provided full information on his disease and treatment option. Informed consent. Consent should be clear, direct, free, informed, intelligent, person and voluntary. Clear in unambiguous words. Direct, indirect. Direct directly conveyed to the doctor by patient with no intermediaries. Free without undue forces. Please informed. Intelligent patient should have clearly understood the implications of the treatment and no ambiguity, no communication barriers. A person or doctor should not be communicate to anyone what the patient has consented for. Voluntary of his own accord. Consent of an arrested person at a police request is not necessary under section 53 CRPC. Consent of an arrested person at his own request. Before 2009, medical examination could be done any time during his custody under section 54 CRPC if he made a request to the magistrate. Section was meant to be used by persons who were wrongly arrested by police who thought medical examination of their body would prove their innocence, or by those persons who were beaten up in police lockup. The section has been amended in 2018. The amended section 54 mandates compulsory medical inspection in all cases of arrest by the police. A copy of the medical report is to be provided to the arrested person or his nominee. If the arrested person is a female, her examination can be done only by or under his supervision of a female doctor. Section 54 CRPC. Consent of victim in criminal cases. In victims of assault, rape, and in cases involving pregnancy, abortion, and delivery, examination of victim is necessary to gather evidence of crime. However, if victim does not consent to examination, it cannot be done. In such cases, police officer may be advised to get an order for the said examination. However, please remember, consent of victim is not needed for informing the police. If patient has directly approached doctor, think that is an MLC. Conflict of consent. When two persons legally competent to give consent differ, case must be referred to court through IO. A case of 10-year-old girl was brought to the order with the allegation of sexual abuse. Girl was neither able to tell the name nor identify the perpetrator, perhaps due to fear. Parents were called for consent. Mother consented, but father refused consent. The case was referred to competent to court for order regarding examination through the investigating officer. Consent of victim of statutory rape. Consent of an alcoholic. Consent of spouse legally required for receiving artificial insemination. Section 14C Delhi Artificial Insemination Human Act 1995. For donation of ovum and sperm. The Delhi Artificial Insemination Human Act 1995. Legally not required but desirable to avoid marital conflict later. MTP, repeated MTP without husband consent have been accepted as ground for divorce. Sterilization. Any operation that can affect sexual life. For a breast reduction, penectomy, penis transplantation. Section 87 IPC. It is not meant for doctors, but the act done by preparator is not done for the benefit of the opposite party. It is applicable to who undertake risky activities. To participate in a risky activity, the consenting person must be more than 18 years. The act by the perpetrator must neither be intended or known to be likely to cause death or grievous hurt. Example, a group of youngsters is playing cricket. A 16-year-old boy comes and requests to play along with them. Act not for the benefit of a but mere a game. They agree. During one of the hits by a player, a hit on the head and eyes We cannot get immunity of consent because A was less than 18 years. If A had been more than 80, he could get immunity of consent under section 87. It was neither intended or known by B that he knew he would hit a shot that would kill. Section 88 IPC, it is meant for doctors because the act done by a proprietor is done in good faith for the benefit of the opposite party. It is applicable to doctors. The consenting person must be more than 12 years. Section 90 IPC. Thus, even for the surgery, the age of consent ideally should be 12 years. No criminal complaint can be brought against doctor. However, a civil suit for monetary compensation can still be brought against the doctor because a child less than 18 years cannot enter a valid contract. Section 11 Indian Contract Act 1872. Thus, to doubly safe, age of consent of surgery is taken as a 18 year. Theoretically, if even physical examination for which of the consent is accepted to as 12 year causes an injury, a civil suit can be brought against the doctor. But the chances of a serious injury from a general physical examination are extremely remote. Definition of good faith given in section 52 IPC. Section 89 IPC act done in good faith for benefit of child less than 2 years or a person of unsound mind by consent of a guardian is not punishable. Following provisos apply. This exception does not extend to the intentional causing of death, euthanasia, or to the attempting to cause death. This exception does not extend the doing of anything which the door knows to the likely to cause death for any purpose other than the preventing of death or grievous hurt, or the curing of any grievous disease or infirmity. Thus, exception does not extend to the voluntary causing of grievous hurt or to the attempting to cause grievous hurt unless it be for the purpose of preventing death or grievous hurt, for the curing of any grievous injury or infirmity. This exception does not extend to the abatement of any offence. Example: A is an unmarried girl less than 12 years. Because A become pregnant, her father approached a CAC not qualified to do GP. CAC performs unskilled operation under section consent from father causes death. The CAC takes defense of section 89 because act was done with the consent of father and was done for benefit of the patient. Cannot get benefit because it is an offence under MTP Act 1979 section 312 IPC for an unqualified person to perform a MTP. What makes consent valueless? Consent given under fear of injury, under misconception of fact, consent of mentally unsound person, consent under intoxication, consent of child less than 12 years. Section 52 IPC definition of good faith. Nothing is said to be done or good believe in good faith which is done or believed without due care or attention. In loco parentis, place of parent in emergency, parents are not available. Person in charge of child, school teacher, a school warden can give consent. If an inmate of a jail, a hospital, etc. refuses treatment and he is likely to spread disease, he can be forcibly administered treatment. Inmate of a hostel may be asked to leave hostel. In state mandated national programs, example pulse polio vaccination, no consent is needed. Consent for illegal act. Criminal abortion is invalid. Consent is not a defense in cases of professional negligence. Discharge against medical advice. If a patient wants to leave against medical advice, LAMA. The dangers should be explained clearly in writing. Then his wish should be recorded in the wish case sheet and his signature obtained. The patient can then be discharged. In the discharge certificate, the doctor should specifically write the dangers of leaving hospital against medical advice. Kind of consent. Consent may be classified according to information provided to patient. Uninformed consent. Information completely or partially held back from patient. Illegal unless it is falls within the concept of therapeutic privilege. Informed consent according to the way patient communicate to the doctor. It may be implied. When patient actions imply consent, telephoning, SMSing, emailing of a doctor, asking for advice, getting OPD card made and then consulting doctor, holding your arm for administration of injection. Some pointers in routine practice, implied consent is sufficient. Implied consent is only for a general physical examination. For examination of a sensitive nature, breast, PPV examination, etc., especially the male doctor express consent should be taken. Making the OPD and gynec and OBG department does not necessarily mean an implied consent for PV examination. Express. When patient specifically consent to examine either verbally, oral or verbal consent or writing written consent when required. In all the procedures beyond routine physical examination, biopsies, blood transfusion, lumbar puncture, operation, pleural and peritoneal tapping, when taken before the act, not after it. Miscellaneous kind of consent. A blanket consent is one where the doctor takes consent from the patient for any and every possible diagnostic or treatment procedure that might have the undertake at any time in the future. Since the doctor himself is not sure of the kind of treatment that may be undertaken, patient cannot be explained of its risk. Many nursing homes and private hospitals take blanket consent in the following manner. I hereby authorize staffs of this hospital to perform any surgical or anesthetic procedure on me. In some cases, a consent is taken even for autopsy in cases of death. Blanket consent is invalid in the eye of law. Case studies: Rogers from Lumberman Mutual Casualty Dolly Dog case consented for an appendectomy to be done. Mr. Mason, defendant. Lumberman Mutual Consulting Company, as was insured. During operation, he found some pathology in uterus and fallopian tube and did a total hysterectomy and bilateral salpingo Europe in addition to appendectomy. Roger demanded compensation for illegal operation. Mason produced a blanket consent form signed by her, which he said I hereby authorize a physician or physician in charge to administer such a treatment and a surgeon to have administered such anesthetics are found necessary to perform this operation, which is advisable in the treatment of this operation. The court held that the above so-called authorization is so ambiguous so as to be almost completely worthless, and certainly, since it fails to designate the nature of the operation authorized for which a consent was given. To have no possible weight, Dr. Mason was asked to pay $35,000 and monetary compensation. Proxy consent, substitute consent, surrogate consent, consent given by a relative, next of kin or a friend in case the patient himself cannot give consent, child less than 12 years, mentally unsound person, intoxication, unconsciousness, etc. Next is informed consent. Informed consent means that consent of patients for any procedure or treatment only can be taken after fully informing him about the nature of his condition. Silent features. Consent should always be informed. Example of uninformed consent: a patient comes to a doctor with chest pain. Doctor advises bypass. Patient is afraid of surgery, but consent since necessary to save life. Bypass done. Patient learns from something that stenting was only an option, but may sue doctor for damages, alleging that the option of stenting was never told to him. This is consent given under a misconception of fact and no consent. Section 90. Example of informed consent name as case above. Doctor inform all options available to him, cost of all treatment outcomes and prognosis unless the patient decide what treatment he chooses. Components of a informed consent. Informed consent has 5 components. Disclosure, transmission of the information which is material to a decision, comprehension or substantial understanding of this information, absence of any outside control over the decision, competence and actual consent. Disclosure, patient must be told nature of his disease, options available, all treatment, cost, risk, benefit, success, failure rate, after effect and prognosis of each. In case of surgery, whether it would be done under local or general anesthesia, possible harmful effect of anesthesia, details of all possible operative procedure there, relative benefit and risk, cost of each, risk of not receiving any treatment, informed refusal, comprehension. Language, explanation must be done in patient's own language. If need be, an interpreter may be employed. Communication problem, if patient has a communication problem, deaf, dumb, blind, etc., doctor should make sure he has understood everything that a normal person with a normal communication power would have understood. Absence of any outside control over the decision. Doctor, nurse, paramedical staff or any relative must not influence the decision. If given, patient voluntarily asks for advice, it may be given. Competence. Patient should be above the age of the 12 year. General physical examination more than 80 years surgery. Should be mentally sound, should not under the influence of alcohol, drugs. Actual consent component 5. Written and witness. To make it legally acceptable, everything explained must be reduced to writing and a signature of patient obtained. Presence of 2 independent witnesses to prevent any allegation that the consent was forged or obtained under compulsion or pressure. Advantages of taking informed consent for reason for obtaining consent. Patient cannot be sued under Section 350 IPC, 351 IPC for obtaining consent by misapprehension of fact, Section 90 IPC. Legally, to examine, treat and operate upon patient without consent, even if done in good faith, is punishable under above section. Principle which form the basis of informed consent. Principle of full disclosure of patient's right to truth. Principle of patient's autonomy. autonomy. Okay. Principle of. Thank you.